the pride of Massapequa, Long Island, New York, Dr. Pierre Corey, a fellow Long Islander. All right, we're going to bring up, thank you so much, James, an intensivist from Missouri who has her own story to tell. And as we all do, I'm just so thankful I'm not having to be up here. I can just let you all do the great work that you're doing. Thank you so much, Dr. James, one of our heroes, critical care.
Thank you. I don't have slides. I'm a clinician, not a scientist, so I'm going to tell you some stories about my experience and about some of my patients. So I'm going to leave you a question to ponder as I talk. What do you want out of your doctor? What are your expectations? What do you want your doctor to do for you? So I'm a board-certified general surgeon and critical care doc, and I'm also certified in functional medicine. For the last 5 years, I've been practicing critical care and functional medicine. And last March, I got sick with COVID. And when I was sitting there, I was watching the press releases and the daily updates. And the governor of New York begged for help, right? Do you remember that? And I said, I need to go. And I was assigned out there to a hospital. I went for 10 days. The hospital I was assigned to generally has 7 to 8 vented patients. When I showed up, they had 75 people on ventilators. So it was bad. And I've tried to figure out how many patients I've seen in the ICU. It's well over 1,000, it may be 2,000 critically ill COVID patients. So it's certainly not the most, but it's quite a few. I ended up from the Midwest, and I had a full-time job there. But what I saw in New York, I wanted to keep going back. So I actually went to a second hospital for a couple of months, and then I took a job at the first hospital. So I lived through the first surge in New York. Then it came to the Midwest in the fall of last year. And then right after the new year, New York surged again. So it's been pretty busy and some pretty long days. There was a point, I do telemedicine as well. So this is across a dozen hospitals in 3 regions of the country and 4 health systems. I had a 40-year-old that needed ECMO during the Oklahoma City ice storm last year. That was a challenge. I had a 41-year-old with a 109-degree fever when I walked in the first night. I had a Cambodian 60-year-old gentleman that I first met in the ICU. I put him on dialysis and we did his trach. A month later, I saw him in the vent unit. He was actually off of dialysis and he was doing okay. And in New York, ironically, 2 months later, he showed up in my other ICU at a different hospital. He had bed sores. He was so weak from critical illness, myopathy, and neuropathy, he couldn't move, and his family was distraught, and it dragged out for 4 months. The most striking experience is I work in a cardiovascular ICU, or I used to, and out of 15 patients, we had 5 on ECMO. And when I looked at the history of those 5 people, I could tie all 4 of them to post-vaccine. And what I found is I talked to patients coming through that unit, when I talked to just like a normal patient after open heart surgery, and when you actually just like learn their story, I could usually tie it back to the vaccine. And I don't think other people were making those connections. But being in the trenches, I've seen pretty much every treatment. And it wasn't until I saw Dr. Corey's Senate testimony that I learned about ivermectin, and I was finally able to treat a couple of patients in the ICU, because most of my orders at most of the hospitals got boxed by the chief medical officer. I had one patient, I walked in at 10 days of standard therapy, and he was on 80% high-flow nasal cannula. I was told, you're going to have to intubate him this weekend. I immediately went to the FLCCC website and I pulled down the Math Plus protocol and I changed his therapy. In 3 days, he was on room air. I don't think in all of the other patients I've ever seen anyone get that well that fast. And he bounced through for another reason, and he stayed off of oxygen and was doing well from a COVID standpoint. I had a patient named Lance. I was also able to treat Lance in my ICU, and he's going to be talking next weekend at the COVID summit, so obviously a happy ending there. His turnaround wasn't quite as fast. We had a couple of weeks that we dragged him through with high-flow nasal cannula. But just recently, he sent me a text of himself on the golf course. He's not on oxygen anymore. He's back at work, and he's very happy with the care that he got. And he had requested ivermectin. So we did that in conjunction with the Math Plus protocol. So in the ICU, intensivists like me, we take the responsibility and we enjoy the privilege of taking care of the sickest patients, those who aren't going to make it. But we need every tool and resource available. Doctors must not be blocked from prescribing life-saving medicine in the hospital. As I mentioned, I myself was sick with COVID at the very beginning when we didn't know what that looked like. So I had natural immunity. So you can probably see where this is going. To Mr. Childer's point, I actually took care of a patient who was 90 days post-natural infection, that arbitrary 90 days. He was vaccinated and showed up in my ICU 24 hours later with a cardiac arrest. That happens. And that's been reported in more cases than that. So because of that, I chose not to proceed with vaccination. I'm now an ICU doctor without a hospital. And I might ask anyone here who's not able to practice medicine like they were a couple of years ago because of the issues we're talking about today, would you like to stand up? I'm in the same boat with you. So I started my own clinic. I do telemedicine. And I just want to talk quickly about a couple of patients there. One of them was Michael. Michael is 65-ish. His wife was hospitalized with COVID. And when he called me on the video chat, he could barely get out a sentence. His stats were 85%. And it was a Sunday night. There were no pharmacies open where he lived. So that night I was really worried that I'd get a call the next morning he had passed because he just looked terrible. The next day, his nephew went to the pharmacy to get his prescription filled. The first one only had a tiny fraction of what I had prescribed, so he didn't even have enough for a dose or two. So I sent it to another pharmacy, and that pharmacy gave me 3 reasons that they couldn't fill it. The first was, well, he already got a fill, and we don't want him to get a double fill. I'm like, he doesn't want to. He just wants one so he can get better. The second one was, the state of New York will not allow us to fill an ivermectin prescription. I said, well, that's funny because your chain down the road just filled it for us, so I don't think that's right. And at the end of the day, they wouldn't fill it. So the family resorted to what a lot of people have resorted to. They went to a veterinary store, and they bought it, and they took it. 24 hours later, Michael video chatted with me. He could talk in complete sentences. His stats were above 90, and he looked good. The doctors who claim these medicines don't work, haven't used them. Because it's very obvious, as Dr. Corey said, it's a reproducible improvement in most of our patients. I had another patient named Dee Dee. We kind of started on a rocky path at the beginning. I saw her for prevention, and a couple weeks later, she called me and had COVID. So I arranged for the monoclonal antibody infusion. She was exceedingly high risk. She had a previous history of strokes and was over 300 pounds. So a lot of metabolic issues. I was able to get her and her husband through the COVID just fine. I was very worried about them, obviously, ending up hospitalized due to their risk factors. She called me a couple weeks after her recovery. She stayed in touch with me and texted me that her son, her 40-year-old son, was intubated and on a ventilator. 2 weeks later, she texted me that he died. That doesn't seem right, does it? The one that got early treatment is okay, and the young child, well, adult child, didn't get early treatment. We see this over and over and over, and that's why we're passionate, and that's why we're here to talk about it. Doctors must not be blocked from prescribing life-saving treatment to outpatients either. So the next case is my last one. and my brother gave me permission to talk about him today. 3 weeks ago, he got sick with COVID. He's 40 years old and is a big guy. Do you know how many 40-year-old big guys I've told you about today? A lot, and there's a lot more where that came from. So we started early treatment, and he kind of didn't bounce quickly, and I escalated treatment. So the question of what do we want from our doctors, I'll tell you what I wanted. I wanted a doctor that would do anything in their power to help my family. And we got in the car and we drove 5 hours to see Dr. Brad Meyer, and he helped treat my brother, and 4 days later he was off of oxygen and he's back at work and doing great. Patients want a doctor who's going to do the absolute best in their moment of fear to help them, to tell them it's going to be okay and bring every resource available to help their loved one. Doctors cannot be blocked. They cannot be threatened. We cannot have barriers like the pharmacies have to provide life-saving treatment for our patients. So I ask you again, what do you want from your doctor, and where are you going to be able to find them?
Thank you, Dr. James. That was awesome. You know, listen, these are the real heroes, right? The people who are in the trenches taking care of patients day in and day out. And speaking of real heroes, are there any nurses in attendance right now? If you're a nurse or respiratory therapist, please stand. And if you've worked as a nurse especially, stand up, please. Stand up. This is the group. This is the group. I mean, I've been in and out of hospitals too. When I'm somewhere today, I have to go visit a patient of mine who's on a COVID unit in the ICU right now. And frankly, he's not doing all that well. But I'll tell you what, you know, as somebody said earlier, I think Dr. McCullough said, these patients have been abandoned, right? So we go into the rooms and we try to give them hope. But the people that are there with them, 12 hours in and out, longer than 12 hours, are our nurses. And I have seen such heroism in the nurses, so I want to thank you all. All right, and now, without further ado, Brian Tyson, Dr. Tyson, all the way from California. He's one of our heroes. He's been treated over 7,000 patients with COVID, and I'll let you tell his story, or him tell his story. Thanks, Brian.
Thank you.